I don't know what to say when you're in your basement, huh, Cher? All right, we'll get back to her in a moment. It is Tuesday and time to check in with our doctor on call. Non-essential medical procedures on hold right now due to the coronavirus pandemic. So what exactly does that mean? And if you need, say, an orthopedic doctor for care, do you have to go without? Joining us via Skype is Dr. Andrew Islam, a TriHealth specialist in orthopedic surgery. Good afternoon, doctor. How are you today? Hang on. We're working on getting Dr. Islam with us. Give us just a second. What happens is sometimes we have to, here we go. All right, we got it. We have him. Boy, isn't it fun dealing with all this technology? Extra technology for us, just when we needed it most, right, Doc? So,
that's right.
Are you seeing patients?
Yes, actually, all the orthopedic surgeons at TriHealth are seeing patients. We've just altered how we're doing it.
And so how does this work now? I guess what you can do, you get to do this way through the computer screen. And what constitutes essential in terms of people coming in right now?
So what we do is, I mean, there are certain injuries that have to be seen immediately and taken care of quickly. Fractures, certain tendon injuries, and we're still dealing with those in the normal way. But the other type of injuries, a lot of times what we're doing is patients will call in for appointment. Our doctors screen the injury, and a lot of time we'll do an initial visit via a telemedicine visit using video. And if necessary, we'll bring them into the clinic. But many of the things we can treat this way, and with certain medications, exercise programs, et cetera.
All right. So how is this working now with your colleagues just kind of across the sphere at TriHealth? Is it kind of up to you as a healthcare professional to decide what's essential and what's not? Because I do see some doctors are opening and kind of deciding how we're going to go about doing things. There's not a list somewhere that says who can do what.
That's true to a degree. Obviously, within each specialty, that specialty decides what is essential and has to be seen right away and how they're going to manage that. Like I've told you, what I just mentioned is how we're doing it in orthopedics. Each specialty is doing it slightly differently.
All right, we're looking at some video here. You know, obviously, if a kid breaks a leg, you got to bring them in. Somebody's having some foot pain or leg pain, knee pain. Do you tell them just hold off a month, or do you kind of like to see those folks? You know, usually you want to kind of touch the area, see what's swollen. It's hard to do that on a monitor.
You know, you'd be amazed at what we can do via the monitor. A lot of times, a lot of our initial treatments, even something like a steroid injection, we can determine that over the monitor and then decide, and then bring that patient into clinic if necessary. Therefore, we keep traffic to a minimum and decrease the risk of any viral spread or contact.
You think we're going to see more of this when all this is over, Doctor?
I do. I think it's the future for a lot of things.
Okay. Interesting note to end on. Thank you, Dr. Andrew Islam with TriHealth. We appreciate your time this afternoon. Sorry about the little hiccup at the beginning. Okay.
That's okay. Thank you.
We do want to turn back to our forecast now.